everybody. I am one of your hosts for Layla's Got You. My name is Reese, and with me is Sorsha. Sorsha, you on mute.
Sorry, y'all. Okay. Hey, my name is Sorsha. I'm with Reese with Layla's Got You, and we have today.
Oh, I am Dr. Terri-Ann Nelson. I was like, oh, it's my turn. Yeah.
How you doing today?
I'm good. I'm good. I'm glad to be here. Happy to be here.
Thank you.
You.
We're happy. Yes, we are happy to have you.
So, would you like to tell us a little bit about yourself?
Sure. So I'm currently in my third year of residency. I am an OBGYN. I'm currently located in Brooklyn, New York. I actually received my medical degree at SUNY Upstate in Syracuse, and then kind of moved back to the city where I'm from, just because I'm very passionate about helping communities that are underrepresented, so specifically women of color. And so being back in the city allows me to do that.
Oh,
That's nice. That's nice.
yeah.
I wish
Like
you was up here in Syracuse because I would love to have you as an OBGYN.
What?
It was too much snow. I couldn't take all the snow.
So, what kind of influence to take this path that you're on?
Yeah.
So I think growing up, I've always been interested in like health and like biology and the body and the human anatomy. And so for me, I was always interested in pursuing a career in medicine. And then more specifically, like a career as a doctor. So that's kind of been my dream since like high school. I think I enjoyed dissecting the fetal pig a little too much. And so, yeah. And so for me, going through medical school, going through all the different like specialties, reason why I chose OBGYN was because I love women's health. I'm very passionate about it. I enjoy delivering babies. I get to do surgeries as well. And then, just here in this country, the maternal Black death rate is dismal. And so being in a position to kind of help address that is very important to me.
I think that's amazing.
That is nice though.
Oh
I
my
like
goodness,
that.
yeah.
Like that is top notch right there. Like what? So
Because
what
I
type
just
of
think, oh, go ahead.
experience? I'm sorry, Source. What type of experience have you had like working in the healthcare system?
So just going through like residency or like basically being trained specifically in the specialty, so I'm doing anything from, your prenatal visits. So once a woman's pregnant, they come and see me up until like their delivery, postpartum care. I also just talk about any sexual and reproductive health. So we can come and talk about like your menstrual cycles or breast health or vaginal wellness, like whatever has to do with the woman's body. I'm basically like an expert in that sense. I also get to perform surgeries, like I said. So I get to like do C-sections, but also from the GYN standpoint, we also like remove like uteruses and we talk about fibroids. So we do a lot within the specialty.
Okay. Go ahead, Source. Answer
Um,
question. Sorry.
She just reminded me of the movie we saw not too long ago, Aftershock. And I had learned, and I didn't notice before, that when Black women or women in general are often given like cesarean sections when they often don't need them. And so that leads to a higher death toll. And I didn't remember if it affected all women or specifically Black women, but that stuck out to me. So I just wanted to see like if that, what she thinks about that.
I'm still yet to see it. I can't find it.
Oh man, no, it's a great, great documentary. I think because it doesn't only look from the standpoint of just the losing a woman, but also the impact it makes on her community. So like her family, as the child without a mother. And so for telling that story from like the father or like the partner's viewpoint and like how they had to like handle like, unexpectedly losing their partner and how that has affected them and has now called them into places of advocacy. It's a really great, great movie. But in terms of like C-sections, unnecessarily needing them, I think there's this misconception that we, as providers, get paid more for C-sections. We actually don't. You get paid about the same as for a vaginal delivery. So I think it's just basically understanding that not all, at the end of the day, our goal is not to cut. We want a vaginal delivery as much as possible, but sometimes there are just situations that may prevent that. And if we're looking at it from the point of how can we have a healthy mom and a healthy baby, sometimes we have to make that tough decision. Like, and we understand that a surgery is a major operation and a C-section is a surgery. So it's a major operation. And I think sometimes people forget that. So it's about being able to listen to your patients even afterwards, because there's a lot of symptoms or things that go miss just because either they downplay their pain, especially in women of color. They tend to, think their pain is not as significant as if it was compared to like a white woman's pain. Or you're not listening to the symptoms of, she's having shortness of breath, or and not doing the proper workup. So a lot of things unfortunately do get missed, and that's not my dog.
Okay. Thank you. Reese.
My bad, I was on mute. Sorry.
It's okay.
Okay, so can you give us like a brief view of what like cervical cancer is and like how can it actually like affect you?
Yeah, no problem. So basically when you look at the woman's like female anatomy, you think about like the uterus, and then you have like the vaginal canal, right? And so the cervix is basically like this little opening that leads to the uterus. Um, and so basically a cervical cancer is called by what we call like the human papilloma virus, or HPV. So this is one reason why, we talk of, or recommend vaccines against HPV from a young age. Reason being because HPV is kind of like a sexually transmitted disease. It's spread through sex. And so someone could be carrying this virus, and then you're exposed to it. And then it can cause the cells in your cervix basically to start to change, and they become like abnormal, right? And so over time, those abnormal cells take over the good cells and basically can lead to the development of cervical cancer. It's a very slow growing cancer, but that's the reason why screening for it is very important. So that's why we
Yeah.
recommend routine pap smears as well as HPV testing. So it's very important that, a woman especially is making sure that she's seeing her GYN annually, undergoing screening, know her results, know when to follow up, and undergo any additional testing if they do find something that's abnormal.
Okay, so how long should you go when you get an HPV test? Like when like how I'm trying to word it. Um like do you go monthly to get it, or which should you go monthly to get it, or like 6 months or year to get the HPV shot? Or do you have
Gotcha.
to like should you get it constantly
Got it.
just to
Yeah. So we actually have this whole specific organization that basically defines or kind of tells us when people should be getting tested and how often. So
yes.
first, we don't start cervical cancer screening until you're 21. So it does not matter if you were sexually active before the age of 21. 21 is actually when we start recommending doing your annual cervical cancer screening. So reason why we say that is because in younger people, like your body is a lot more healthier and can kind of, if something is going on or if it is exposed to this virus, it can sometimes take care of itself and
Yeah.
deal with it on its own. So that's why we don't start until 21. Um, so depending on your results, so let's say you do a pap smear, everything is normal. We say follow up every 3 years,
Yeah.
from like the age of 21 to like 29. Um, we say every 3 years, but from the age of 21 to 24, we're just doing a pap smear, which is like one part of the screening for cervical cancer. And then once you're 25, we start also starting to screen you for HPV. So it's like a two-part test. Once you turn 25 and above, we specifically look for HPV virus.
Okay.
And like I said, if everything's normal, 3 years. Once you turn 30, we would recommend it every 5 years if everything's nice and normal. If things are abnormal, if something comes up, like there's something going on, there's like different stages to this and how we define the result,
Yeah.
which is like there's a whole algorithm, there's a whole specific app just for this test. And depending on what your results are and what age you are, it will tell you what to do next. But basically, depending on what your results are, how significant they are, we might say, hey, we may need to follow up sooner, like repeat your pap smear and HPV test in a year from now. Or we might have you come back to the office to take another look at your cervix, where we would take like a biopsy of it just to kind of get a deeper look at your cervix to see what's really going on. Is there cancer there? And then if there is, we'll say, okay, now we take you to the operating room where we'll basically remove parts of your cervix that has
Yeah.
that normal cells or like pre-cancer cells and kind of treat it that way. That makes sense.
Oh
It's a
wow.
lot of so basically, to answer
That's
your
wow.
question, yeah, it depends on how old you are, what your results are. That will kind of determine when you follow up.
It sounds intimidating.
It do.
Like I said, there's a whole entire app dedicated just for this specific test. And like every few years, they change their recommendations, but to the whole app that has a whole algorithm that you just look at.
Oh wow. Think wow, an app for it. But
I
an
know.
app for everything like at this point.
Right, exactly.
Um, so what kind of advice can you give somebody that's scared to like go get screening?
I think it's not knowing is more putting yourself at more of a risk rather than just undergoing this testing itself. So I
Yeah.
think what happens is people are scared of like what the pap smear consists of because it is an uncomfortable and very intimate exam. So basically, it is a vaginal exam. We place a speculum inside, which is usually the most uncomfortable part because it's just a lot of pressure and can cause discomfort. But it's a very quick like swab of your cervix. So it lasts like it's like very at most a minute or two for the exam itself. So I would say you should just undergo a couple of minutes of a very uncomfortable exam and rather than risk having a cancer that's developing over time. And now we're looking at major surgery to remove everything or because you don't know what's going on. So if you could take those few minutes to do the testing, that way you can help prevent the development of a cancer. You rather do that rather than just not doing it because you're uncomfortable to do it.
Okay.
Yeah.
Hi, Zipporah. Yeah, we have this is also like an extra co-host too. She is joining us today. Hi, Zipporah.
Hey,
Hi.
Laura.
So we're talking to Dr. Terry. She is an OBGYN. And we are asking her questions about cervical cancer. Since it's cervical cancer awareness next month, right? Yeah. Okay. I like the little head nod, Sorsha. I like it.
Because I was trying to think while I'm saying it. I'm like, there you go.
Do you have any questions, Zipporah, for Dr. Terry?
I'm gonna think of some.
You got
Well,
any
Dr.
questions,
I just
Sorsh?
wanna. Oh, I was gonna just thank her for her work because, like, I had not just recently had my first Black GYN till about 2 years ago, and like, I can't tell you how happy it made me. Like, I'd never felt so comfortable in a doctor's office.
Like
So,
for real
like,
though.
that means a
I
lot to me.
understand.
I want to say thank you.
No, well, thank you.
No, because
Absolutely.
I know how she feels because I had the same type of experience too. Like like I was in the hospital because I got POCS. So
Mhm.
it's like and I was bleeding horribly. So it was like the doctor that was taking care of me apparently wasn't doing it right. So then when the black girl had came in, yeah, she was like, they didn't do this, they didn't do that, they didn't do that. I was like, thank you. She knows.
Yeah.
She knows.
No, it's true.
But
Sometimes
it
you just
most
want to
definitely is
feel
an exam.
seen or heard. Yeah.
Yeah. Like it was most definitely like a different experience. I was trying to get her as my OBGYN, but she had moved.
Oh.
It was sad. Sad to see her go. But it's
Oh.
okay. If I had the funds, I would have moved where she was at. But yeah, it's the field to go into that field. I give you your props for that because I don't think I'll be able to do it.
I know it's a rewarding but very demanding
Yeah.
career, but I definitely love it. And like you saying, like I love that moment when I walk into a room and I'm like, hey, I'm the doctor, and then it's like a patient of color and she sees me and she's like already just feels like she's excited because she's like finally like a person of color, you understand me, you're gonna get me, you're gonna I feel like, or they feel that they'll be very treated well, or that they'll be managed well, they'll be finally
Absolutely.
heard. So it makes a difference.
Yeah, it does.
Absolutely. And what's your end goal with the work that you're doing and that are we going to be doing in the future?
Good question. So like I have another year of residency, and as that kind of comes to an end kind of soon or quickly, it's like start thinking about like my career, like what do I want to do, like do I want to go into private practice, so I want to stay academics. I'm still figuring that out, but I think ultimately I want to be able to either open up my own center or create a space where I'm able to just like pour into the community, being able to educate, create a space where like women of color feel safe, especially when in their pregnancy, as birthing women. So we'll see what that looks like.
Okay, that sounds great. I wish you all the best luck.
Thank
Truly,
you.
of course. Zipporah or Reese, did you guys have anything else you wanted to add or mention before we kind of wrap things up?
What's the what's the percentage of somebody of a younger age under 21 to get cervical cancer?
It's very, very low. Because mostly with cervical cancer, it's like usually you would have to have like constant or continuous exposure to the virus, and that's like through like sex. So we are aware that younger people are having more sex and things like that. Like I said, because they're
You're
healthier and their body is more equipped to like basically kind of take care of that virus. It's very low risk in that population, in that sense. And then like I said, we do recommend a vaccine starting at like age 12 that protects against major high risk strands of HPV that can cause cervical cancer. And so, um having a young person having this vaccine before they even start having sex is a great protective factor. And then even if you're an adult and you're older, that vaccine is now available up until the age of 45. So that is still an option if you didn't get it as a child.
okay. Yeah, I was just curious because it's like I know they like there's probably like a rare case of somebody under the age of 21 catching it. I'm just like you just never know.
Right. Yeah.
Do anybody else have any questions? No,
I
nobody
think
else.
I've learned a lot and I'm definitely very thankful for being on this call.
Yeah, me too. Because I don't know, because I really sometimes I be scared to go to the doctors, especially because I be scared like I'm gonna find something out.
Mhm.
But just going is just do it. How Shia LaBeouf said, just do it.
Just do it.
And just go. But I be scared sometimes. I be figuring like, damn, what happened if oh sorry. What happened if I go and then they come back and say I got something? But
But
that
I
would just
think
be
I
me
think
being
with
over dramatic.
right now, not all. I think sometimes though, like being able to catch it early or when you're in a position to kind of maybe do more or to like create change,
Yeah.
I think that's more powerful, rather than just like avoiding the doctor for years. Because you also see that where people are scared and then just avoid, and then they come in where things are like now far beyond, and had they come in
Yeah.
earlier, we could like had more options. So I think it is can be a little intimidating coming to the doctor's office, but I always advise like have 3 questions or 3 concerns, like kind of written down that you want to address during that visit. Like make that visit work for you, because although
Yeah.
as doctors we are on a time crunch, but like so make the most out of your visit. I don't want you ever to leave the doctor's office being like, oh man, I never asked this question, or oh man, I don't actually know what this means.
Yeah.
Don't be afraid to like use your voice, ask questions, and get your concerns addressed.
Yeah.
That's my
Because I've
always
go ahead,
forget.
Zipporah.
Oh, sorry. I always forget, like, I have these lists of concerns, but then when I go to the doctors, I don't remember all those lists of concerns.
Until you leave the doctor's office and then it hits back into you like, damn, excuse me. Like I meant to ask the doctor this question.
Yeah.
Write it down. Right? Like you have that little note tab in your phone, just write it down and be like, hey, these are like one or two or three things that, I'm concerned about or have questions about. Like, can we spend some time like discussing that? Right? Like I said, it's your visit. You're kind of paying for it right through your insurance. So
Yeah.
make the best out of it.
Thank you, Dr. Terri, for all this wonderful information about cervical cancer.
Thank you.
We have learned a whole bunch of a lot of stuff. I know I did. Cause now I'm gonna go get screened for I'm gonna go screen for it because I'm 27. Look here, I'm hitting the age of 30. It's I'm starting to feel it. So I'm going to get screened. But thank you, Dr. Terri, so much for the lovely information. That was all for Layla's Got You podcast. Like, subscribe, share. If you have any comments, please put the comments in the comment box. Thank you very much.
Dr. Terri, did you want to throw your socials up or anything?
Oh, sure. Yeah. So like I said, I'm all about educating. So I use my platforms to definitely educate on certain topics, but regarding like women's health, sexual health, reproductive health. So you can follow me at Paige and Dr. Terri on Instagram.
Okay. Thank you for sharing.
Thank you.